Hi, everyone. My name is Donna Kozier. I am the coordinator for the Bristol Early Childhood Alliance. Thank you all for coming to our presentation. This is jointly the Health Committee of the Bristol Early Childhood Alliance and the School Readiness Council here in Bristol. Our presentation, Keeping Kids Healthy During Respiratory Virus Season, presented by Tina Tengwe. So Tina, I'll let you introduce yourself and go forward with the presentation. Thank you.
All right, thank you so much, Donna. Yes, my name is Tina Tangway. I'm one of the public health nurses at the Bristol Burlington Health District. And I've put together just a little bit of information about how to keep kids healthy. As we know, with virus season coming right up, it's always important to watch out and make sure that we can do what we can to keep our kiddos and ourselves healthy and well. So the topic today is on respiratory viruses. And there are several that we talk about when we kind of talk about this topic, but all of them are kind of spread the same way. It's spread by respiratory droplets when people cough or sneeze, speak, or sing. And they're more common in the winter months, like now in December. Because we're in such close quarters or indoors more, we tend to huddle together and gather for holidays. These viruses like to transmit more quickly. The ones we're going to be talking about today in specific are the common cold, influenza, or the flu, RSV, also known as respiratory syncytial virus, and COVID-19. Largely, these viruses do get better on their own without really any treatment, and they don't respond to antibiotics, meaning antibiotics won't work to kill the germs. So this is a quick slide about how to tell the difference between what's going on. Is it a cold? Is it the flu? What can I see in my kiddo? Like what symptoms am I normally seeing that represent what kind of bug, right? So as you can see, the yellow circle shows that the symptom is rare. The orange circle shows that sometimes that happens. And the red circles show that, yes, this is common. So colds are usually marked by sore throat, aches and pains, and fatigue, whereas the flu has more of the fatigue, fever, aches and pains, maybe some coughing. And COVID really has more of that fatigue factor, a sore throat, difficulty breathing sometimes if somebody's really, really sick. So talking about the difference between virus and bacteria is also important to understand. Viruses are germs, not like bacteria, they're different. So bacterial germs like strep throat and whooping cough respond to antibiotics. That means the antibiotics can kill the germ. Some other germs like bronchitis, ear infections, or sinus infections can sometimes be viruses and sometimes be bacteria. And it's worth a conversation with a provider to see if someone with these types of germs need antibiotics to get better or not. And viruses, like the ones we're talking about today, the cold, COVID, and flu, don't respond to antibiotics because they're a different type of germ. So ways that we can protect ourselves and our littles is really, if you think about a bunch of pieces of Swiss cheese put together, it's called the Swiss cheese model, meaning that no one single thing you do is 100% perfect, right? I would love to be able to say that, yes, just do this and your kiddo is never going to get sick ever again. That would be so easy, but unfortunately, that's not our reality. The Swiss cheese model says that if we layer these strategies together, it's going to offer better protection. Because these germs may get through one hole in the layer of the Swiss cheese, maybe even two holes through two different pieces. But if we add that third or fourth layer, things will get harder and harder to get through and cause an infection. So these are some very simple things that people can do to help lower the risk of getting a virus. Washing your hands is number one strategy. Keeping your hands nice and clean when you're not using soap and water and you're in a time where you do need to wash your hands, using hand sanitizer can be done. Wearing a mask around folks if you know you're sick, and not touching your face with your hands that are unwashed, covering coughs and sneezes with tissues and then throwing the tissue in the garbage, staying away from others when you're sick, and cleaning frequently handled items like your phone or things that you handle a lot throughout your day, like a remote control, faucets, things like that. And these certainly aren't the only strategies that they offer. Taking steps for cleaner air, meaning getting fresh air inside where you are, or going outside, can offer air with less germs in it to breathe in. Staying up to date on immunizations is a core strategy to make sure that we all stay healthy and well. Staying home when you're sick and talking to a doctor about any risk factors you may have if you get sick. So they may be able to give you some medicine to help you get well faster. So this is probably one of my favorite pictures. The average person has between 10,000 and 10 million bacteria on their hands at any given time. And germs are just ever present in our environment. I could go on and on about germs, but I won't. I'll spare you. But they spread from person to person and on surfaces when you touch your eyes, nose, and mouth, or you eat or drink, and then you go touch other objects with unwashed hands, you're just sharing germs, unfortunately. So ways to prevent that is to wash your hands and blow your nose or cough or sneeze into a tissue, or wash your hands after or use your elbow. Steps to hand washing is really easy to miss. It seems very simple. Turn the water on, add the soap, rinse the hands, turn the water off, dry the hands. But really what you want to do is turn the water on and get your hands wet first. Then add the soap. Rub and count. The easiest way is sing happy birthday to yourself 2 times. So that's about 20 seconds. So you want to get the palms of your hands, the backs of your hands, in between your fingers, your thumbs. The one we miss the most is the fingernails. So scrubbing in a circle on your palm with both hands, and then get your wrists. And then rinse your hands from your wrists down to your fingers into the sink. Can help wash those germs down the sink drain. And then dry your hands. And if you're in a public bathroom, taking an extra tissue and turning the faucet off with a tissue is a really good strategy, because the sink handles on public bathrooms are really pretty gross. And so that's how I would wash my hands. Littles may need help. They may have not able to reach the sink on their own, not be able to push to get the right amount of soap, and not be able to lather their hands very well, depending on their age. So they may just need an adult's help to wash their hands well. So moving on, another strategy is covering your cough when you sneeze. You've all seen this sign, but what does it really mean? So if you cough into your hands, then your hands just have germs, right? So the vampire cough, as my daughter likes to call it, you just cough into your elbow, will help keep your hands clean if you don't have a tissue to be able to cough or sneeze into. So talking about vaccines, there's several vaccines that are out there to help lower the risk of serious infections. So vaccines aren't perfect. And I know that message has been said over and over again that yes, get your vaccine, get your vaccine. Because they do offer good protection against bad outcomes. So yes, people may here that you could get COVID after getting vaccinated, but your COVID symptoms may be far less when you're vaccinated versus what they would have been had you not gotten the vaccine. RSV, or respiratory syncytial virus immunizations, also are given to pregnant people and older folks to be able to protect those age groups because they're the most at risk for RSV. A thing called monoclonal antibodies, which is a shot given to babies, can also protect them from RSV. And because RSV in babies can be really serious and life-threatening, unfortunately. So the ones that are eligible for shots, if we get the shots, it also helps protect those who are the most vulnerable around us. So this is just kind of a schedule for vaccines. So one key strategy is if you're sick, stay home. Um, we've all heard the guidance through COVID about, oh, well, if I get COVID, if I test positive, I should stay home for 10 days. And then it was 5 days, then I can return home. But if this, then that, what's new, what's wrong? If I tested, but I don't have a fever, there was too many rules, right? So now it's just kind of simple. If you're sick, stay home and away from others until two things are true. You are fever-free for 24 hours without the use of medicines like Tylenol or ibuprofen to lower your fever, and your symptoms are getting better overall. If that's true for 24 hours or more, for the next 5 days, it's a good idea to take added prevention strategies to help protect others from catching what you have. Just because you're feeling better, unfortunately, still means that you can spread germs. And staying away from others, like what's called social distancing from people that could get really sick, is sometimes important. So helping keep others well is the name of the game here. So in school settings, if a child has a fever, keeping them home from school so others in their class don't get sick is a really good strategy. Or out of daycare, for instance, which is really hard to do, but it's best case scenario for others around you. So with that being said, I know it's kind of short and to the point because I know we've been hit constantly with these messages, but I just wanted to make sure that we've got the basics down. And kiddos really could benefit from a lot of these um, interactions and making sure that we all do our part in keeping kids healthy and well. Because when kids are well, parents are well. And when parents are well, they can take care of their children. With that being said, if you have any questions or you need help getting connected to care, please always feel free to reach out. Again, my name is Tina. I work at the Bristol Burlington Health District. I am a part of Bristol Early Childhood Alliance and the School Readiness Council in Bristol, and I can be reached at that number. And thank you very much. With that, do you have any questions that I can answer now?
Thank you, Tina. So I think I'm going to stop the recording and then we'll go into questions, if that's okay.
Thank you so much.
Okay. All right. That was great.